Hello, my name is Anand Mantravadi. I'm an assistant professor at Jefferson Medical College and on the glaucoma service here at Wills Eye Hospital. I'm here to talk about diagnosing glaucoma. Glaucoma, as many know, is one of the world's leading causes of irreversible blindness. It is characterized as an optic neuropathy, or a certain characteristic damage that happens at the level of the optic nerve. It can be a real challenge to diagnose. It is silent, it is chronic, and many people who have glaucoma don't know they have it. The first steps to diagnosis is being evaluated by an eye care professional. Generally speaking, one might examine the front part of the eye, measure the vision, measure the intraocular pressure, and take a very careful look at the optic nerve as it relates to the other structures inside the eye and as it relates to the other eye. The diagnosis of glaucoma is defined as a progressive loss of parts of the neuroretinal rim in the optic nerve over time. When a certain amount of the optic nerve is damaged, it then also compromises the visual field, or how much light the eye can capture. So therefore, diagnosing glaucoma clinically is started by looking at the optic nerve and seeing if there is the presence or absence of this characteristic optic neuropathy. However, sometimes that alone can be a challenge. Sometimes we require a lot of other supporting testing. For example, imaging of the optic nerve or optic nerve photographs that might have demonstrated some change over time. Furthermore, functional testing such as visual fields are paramount to the diagnosis of glaucoma. Understanding how much light the eye is sensing, and if there is a small deficit or a deficit of any size, is that changing over time, is critical to monitoring patients with glaucoma over time. A common misconception is glaucoma is just a disease of eye pressure. Eye pressure is the modifiable risk factor that can be controlled that lowers the rate of progression in many people who have glaucoma. By lowering eye pressure, one can lower the rate of glaucoma damage. However, there are many people who can live at slightly above average eye pressures and never have a problem. And furthermore, there are people who can have normal eye pressures who do also develop the characteristic optic nerve damage that we define as glaucoma. So although lowering eye pressure is paramount to reducing the rate of progression and even helpful in diagnosis, it by itself does not diagnose the disease. Thank you very much.